During the past 15 years, the majority of countries in Africa experienced continuous economic growth. The continent's economic fundamentals remain strong, and as a result, there's a significant impact on increasing urbanization, technological innovations, social mobility, as well as increase in the average life expectancy. It is this quest for innovation that The Economist organized a summit dubbed Innovative Economies, Diversifying Economic and Healthcare Innovation for Tomorrow's Africa on 1st February 2017 in Nairobi. The summit brought together key industry players to discuss ways to improve Africa's economy through innovation. All right, hi everybody, my name is Winnie Lubembe and we're here today at the Innovative Economies event organized by The Economist, and we just want to understand what was the basis or the purpose of this particular event, and have they achieved what they wanted to, and of course moving forward, what are some of the recommendations that they have in order to improve the universal healthcare in general. So we are here with the chairman, and he's here to address us. So innovating economies, let's start from there. What is it?
So I've been covering Africa for a few years now, and wherever I go, I'm not a tech expert, but it seems to me that one is seeing technology and innovation transforming all sectors of life in Africa.
Yeah.
So on the one hand, one is seeing this kind of amazing power for democracy that is coming out of technology. Whether it's social media in Ghana, whether it is citizen activists in Nigeria who've been able to monitor elections and ensure that elections are free and fair, because anyone who's trying to crook the books is getting them, they're getting caught out by people taking cell phone photos and sending SMSs and WhatsApps. So I'm seeing, so democracy is being transformed, and then if one looks at economies, one is just seeing this amazing bubble of innovation that's coming out. Now we all know the story about how many countries in Africa have leapfrogged ahead when it comes to phones. Who has a landline anymore? Africa's gone straight to mobile. And I'm really fascinated by the ways in which that kind of leapfrog is happening elsewhere. Yeah. So if one looks at solar energy and electricity, we could wait 50 years at the current pace of electrification, and many of us still wouldn't have electricity in our homes. Or you can look at the kinds of M-Copas and those sorts of innovations that are really just saying, do you know what, we don't need to do it the old way. We just put something on your roof and you've got enough electricity. Yes. So there's a lot of innovation that is just leapfrogging ahead. Mm-hmm. And that's really exciting as The Economist and how we report on Africa. Mm-hmm. And where this comes in with health is that so many times when we talk to tech guys and you say, where is tech going to be most effective? Where is the next leapfrog? Yeah. They say it's health. Mm-hmm. You then speak to the health guys and you say, what is going to impact the way you service people? How are you going to get healthcare out to the villages? And they say it's technology. Mm-hmm. So we brought the two together, and we had innovating economies and innovating health. Mm-hmm. And the two have worked really well.
Mm-hmm. Healthcare sector is a major contributor to Africa's economies, but still faces numerous challenges, among them inadequate resources, doctor-patient ratio, geographical barriers, and political tensions.
Perhaps you could talk us through what you think are the most important opportunities for the drugs business, for the pharmaceutical business in Africa. What are the things? What are the next big things that you guys are going to do?
We are facing somehow similar problems in terms of lack of infrastructure, lack of early diagnosis, lack of capability, lack of health workers. But at the same time, we need to acknowledge that the specific solutions that we need to put in place to make the treatments available are probably very different from the ones that we found in the context of infection.
We have a major issue about accessing healthcare. So a lot of people living in Africa have to travel long distances just to find a health worker who can give them treatment. And this geographical barrier is a cost.
I think that probably capability building is one of the big themes on that arena. How can we ensure that on the one hand we partner with governments and with private institutions to train more healthcare professionals, because in some cases there are just a handful of specialists when it comes to oncology, rheumatology, or other secondary specialty care in areas in some of the countries in Sub-Saharan Africa, and it's also about making sure that the capabilities reach a certain level of standardization across not only physicians but also nurses and other healthcare professionals. And this is an area in which we are, as Johnson & Johnson, partnering very much with a number of private institutions.
According to the Health, Nutrition and Population Statistics for the Millennium Development Goals, Sub-Saharan Africa lags behind the rest of the world in relation to the under 5 mortality rate, maternal mortality rate, and prevalence of HIV. It is evident that for Africa to accelerate inclusive growth and job creation, both private and public sectors need to come to play. So what is the case for investing in healthcare in Africa?
So if we want to bring quality healthcare and change the health indicators in Africa, we need to look at how to deal with this geographical barrier. And can we have disruption through technology and innovation? And this is where telemedicine or e-health and m-health needs to be brought into the fold. If we can do it with financial sector, we can transfer money in amounts by everyone. Can we bring healthcare closer to the people? If you don't need to go to a bank to bank, and you don't need to go to a shop to shop, do you really need to go for healthcare to a health facility? Can you have a lot of this transferred to the homestead instead of the hospital doorstep?
Regulators and us as a society are not able to keep up with the rate of change that technology can unleash. So that is a big piece, right? So today, for example, if you let me, I can start a pharma retail business which would have almost zero inventory at the retail outlet itself. I can send things to you by drone. It is possible. I can do it starting tomorrow, but then it would be illegal. I think in terms of visionary regulatory stuff, I think Kenya in particular has done, and again, this may have been right things at the right time, the right people, etc. But frankly, India is still struggling with the M-Pesa equivalent and how to unleash that. It is $1 trillion economy. If they do a little bit of what Kenya has done, it will dramatically change the world because it's a much bigger economy.
So right now in Africa, I think we need to finance a lot more of entrepreneurs, but also finance a little bit of research. The balance is higher entrepreneurship and a little bit of research, so that the entrepreneurs are actually getting the business that's informed by research. That's very critical. The second aspect is we need a healthy public-private dialogue. There is no way that the public or private can do it alone for the 1.2 billion population in Africa. So this effective mix between public-private dialogue is the answer for better healthcare in Africa. To build a health system in any country requires leadership, resources, and partnership. So I think what's coming out from the doctor strike, that we have a lack of leadership, resources, and partnership. All three need to be addressed for better healthcare for Kenyans.
A report by the World Health Organization indicates that the world will be short of 12.9 million healthcare workers by 2035. In sub-Saharan Africa, these shortages are expected to be acute. Achieving universal health coverage is impossible if everyone does not have access to well-trained health staff.
A huge issue everywhere in the world, but it's also a huge issue in Africa. The question of how do you get enough skilled people to the right place to talk to patients, to deal with patients, to do the prevention work, how can that be augmented with artificial intelligence and distance learning? What have we learned from what's going on around the continent?
In Mozambique is a big issue because you don't have enough training schools. So one of the issues is to increase the number of the schools. In the meantime, because to build a school, it takes time, we have to find alternatives. And one of them is to rent other schools to train health workers, and we did so. We have to have a partnership between public and private sector in terms of producing new medical staff. And it's not only the problem of producing, but the allocation. So we have to face the problem between rural and urban areas. You know that if you are born and trained in the city, it's quite difficult to move to a rural area. So we have to find people coming from rural areas that it will be much easier to place them and to work in rural areas. Otherwise, we will have an inequity distribution of health staff. So this is one of the big issues that we are facing, and we have to have policies that create incentives for people going to more remote areas. And those incentives need, of course, fiscal space. We need money to do that.
If things continue the way they are, we probably not going to get there. So I think what I'm advocating for solving the issues of shortage of healthcare workers in general and accelerating the pace of reaching universal access is probably creating a new architecture for us to start looking at this issue. Because the way I'm saying it, I think for the longest time, we have basically decided as a community that governments and ministries of health had this major responsibility, leaving out very many actors. So I think we need to get inspirations from the changes that we have seen in the international development landscape. Let's face it, in the last 10 years, this landscape has changed so much, and it continues to change radically because we have new actors, including a bunch of social entrepreneurs who think they can do it faster, better, cheaper. We have the private sector. For the first time, the doors are kind of wide open for the private sector to come in. We have academic institutions that have traditionally gotten engaged in these fields, but mostly to do research or look for opportunity, and they are looking to be engaged a lot more robustly. And then you have the traditional NGOs, which are trying to figure out now, what's our role and what's everybody's going. So, and what we don't have is that architecture to do this.
The doctors from Africa that go to Europe and America are often economic migrants. The doctors that come the other way are coming for, most people think they're coming for a few weeks, but of the 3,000 plus that we've placed, they come for at least a year or 2 years, often a lot longer. But even that's not forever. The reality though is that if you've got a hospital in a rural area with no doctors, you cannot find a local doctor who will leave their practice in a city, their home, their professional education, the schools their children are going to go and live in a rural area and work 24 hours a day because there is no support. What we've managed to do in a significant number of facilities is to bring these doctors from the US, from Europe, who have a missionary zeal about what they're doing, who are willing to work for those year or 2 years and really put back into the system in which they're working, and use that core of 3 or 4 foreign qualified doctors to seed the attraction of local skills, such that when they leave, first of all, there's a local team that's sustainable, and second of all, there is it's a lot easier to attract new foreign skills, more junior foreign skills to those facilities, because there is a local team with whom they can work. This is the number one thing that attracts doctors to Africa, actually. It's the work experience. after the humanitarian appeal is probably second on the list from the doctors we've spoken to. But that is why I think it's important to look at placements coming for at least a year or 2 years. We found through surveying the 600, 700 plus facilities we work with that it takes about 6 months for a foreign qualified doctor from Europe and America to learn the ropes. Thereafter, they can start giving back. And we think it's only fair that if you're going to come and you're going to give them the opportunity to improve their skills, that they stay long enough to contribute back in equal measure.
I think one of the biggest challenges that we have as far as tackling the skills shortage is first understanding the skills shortage. Pat mentioned earlier, some of the most recent data we have is from 2006 that talks about, how many doctors, how many African doctors. By the way, we also speak about Africa as one block. It's 54 different countries with completely different dynamics. And so data that revolves around how many Africans move to the 10 biggest OECD countries, for example, and what are their professions and so on. And this is data from 2006, doesn't really help us solve the problems in 2017. And so one of the first reasons that I got into this was because I read, in fact, in some reports that there are more Malawian doctors in Manchester, UK than there are in Malawi. I don't know how true this is. I also read that there are more Ghanaian doctors in New York than there are in Ghana. And so my original intention, in fact, was to, first of all, verify, is this true? And if this is true, then surely somebody should do something about this.
In terms of the doctors, one of the issues that we are providing is a house. If you are in the remote area, the government provides a house or gives you the money to pay a rent.
Right.
And provide this. After 2 years, you can get to a specialization training. So if you go to outside, it's much easier to get back and start your post-graduation studies.
I think we have to think, as you mentioned, we need a new architecture if we're going to tackle the skills shortage. And part of that is the admission that the African diaspora represents a true human resource. They're part of our best exports, unfortunately. And where they are, they're contributing to scientific innovations, to essential medical advances, to different specialties. Within the different specialties, they're innovating. And so we need to find a way of engaging them. Even if they don't set foot on African soil, we have still got to find a way of engaging them.
It's a complex problem because it's a human problem. Behind every shortage of health workers, behind every figure that is cited, there is a person. There's a health worker that has needs that we need to help fill. That's why at IntraHealth we like to say we would like to see health workers that are present, ready, connected, and safe. Present is where they are needed the most, meaning that they need to be well distributed, they need to be prepared, they're ready, and they need to be connected technologically and to the system. And they need to be safe because we are seeing throughout the world people attacking health sites, health hospitals, and health workers being killed, and we cannot afford that.
The policymakers have to think about it, to think that health is an investment. It's not an area that the government is only losing money. It's just because in the health sector, you can develop the economy because you have the production of drugs. You can increase the industry of drugs, infrastructure, so you can have the infrastructure enterprise growing. We employ people. The health sector is one of the big employers in Africa, particularly from the government perspective. Health and education, those two are the big employers in Africa. So, and all the logistics related to the health, like food and so on. So now people are looking at the health as an investment. And if you have wealthy people, the economy grows more, grows faster. So improving health of the community can actually improve the economy of the countries. That's why many policymakers now are looking at the health as like an investment.
A few things we can do. I think if we invest in frontline health workers, if we invest in community health workers, because we can afford that. We might not be able to afford doctors and highly trained physicians and so forth. We should continue to do that. But right now we have readily available lay workers and community health workers who are close to their population, who can do door-to-door, and who can link with the service delivery on the health side. So I think Africa's chances of success will be amplified if we are courageous enough to start investing our own domestic resources into training a cadre of frontline health workers.
Investments in healthcare business can be a costly affair for both service providers and investors who are innovating to deliver quality at a lower cost while still remaining profitable. Take a look at this one-on-one conversation that provides an assessment of what makes low-cost private sector healthcare models successful.
There is a bit of a risk when these organizations are just about breaking even or not to actually sort of branch out into, let us add this little bit of care, let us add this little bit, which makes them diversify, which makes it actually harder for them to achieve the operational excellence that probably allows them to bring the cost down enough to become profitable. So what the solution there would be, both from a system, so from a perspective such like yourselves, or from an investor perspective, how do we create a proper value chain and how do we create proper referral pathways? Because somebody may get complications and may need secondary, tertiary care that can't be provided at that particular facility. The answer may not be build it in that facility, because then again, the costs probably go up. But an answer should be, how do we create good referral pathways? So these innovations shouldn't be seen in isolation as, and sorry to repeat myself, sort of the silver bullet, but they can play a really, really important part in the set of entities that provide health.
Chronic non-communicable diseases are the major cause of death and disability worldwide. World Health Organization now projects that 28 million people in Africa will die from a chronic disease over the next 10 years. What are governments doing to tackle the issue? Should wellness rather than treatment be given more attention at policy level?
We created something we call Vision 2030 for Kenya. It was a total partnership between private sector and government officials. This to me is a success story I will always remember. What I don't remember now is how we are interpreting that vision to achieving the goals we set up. But in Africa, to go back to a wider sector, is that governments could benefit a lot by sitting with the private sector. The private sector are the investors of their wealth, their sweat, their time, their vision in the businesses they do. And if only they sat together with the government officials at the beginning of the year, budget creation, government vision for the year, and discussed what government thinks they would like to achieve during that year. And private sector putting in knowledge of what they think government should do in order to fast track development. We do not. We don't sit together. Officials create budgets, they read the budget, they implement their budget, and the private sector has to run behind that budget to follow. If you created a budget which is in tandem, in partnership with what private sector sees, they will help you.
It's a bit frustrating sometimes dealing with governments, but we are seeing that more and more governments in the African region are taking non-communicable diseases seriously and investing in it, not to the level that we would want, but they are investing in the prevention and control of non-communicable diseases. What we normally let them know is look at your data from your hospitals. Who is presenting with what? And what are you spending on those particular patients? And many studies across the African region are clear that at least half of the clinical budget is going into non-communicable diseases. If we throw in accident victims, the figure goes up a little bit higher. So if you compare where you are actually spending money on, you should really be planning on how to spend money less in that particular area by preventing, early diagnosis, appropriate treatment, so that people don't come back with complications that will take a lot more resource to be able to rectify. The NCDs are easier to prevent early than it is to avoid communicable disease, particularly in our setup where the environment is so prime for communicable diseases. So we make these cases using their own data. Many times they understand, most of the times they don't react appropriately, but we know that with time we are going to get to a place where the majority of the countries in the region are doing the appropriate allocation and therefore taking the action that is required.
Prevention is very key, and governments need to have good policy and implement that policy so that we get many people avoiding getting non-communicable diseases. As WHO, we advocate for a multi-sectoral approach. We advocate for adequate funding for non-communicable diseases. We advocate for appropriate staffing, both at the policy level and at the facility level. And we advocate for strong, effective policies, including law, administrative announcements and things like that. But they should be strong, they should be effective, and they should be implemented.
Homegrown innovation is vital if it is to compete on a global stage, and the importance of research and development cannot be overlooked. How can we create an entirely new ecosystem of healthcare providers and encourage more youths to take up the role?
In general, you find that African countries' GDP is records one of the highest in the world. And in fact, in some African countries, you'll get double-digit GDP growth. But then when it comes to productivity ranking and clearly our competitiveness, we rank very, very low. And therefore, the big issue here is how then do we efficiently produce our products and services?
Various sectors are required in order to drive growth, to drive investment. Today we still have to import people to come and fill some gaps which we don't address in our education system. Why should we do that? Then we have a lot of educated young people who went to school, learned some useless subjects they cannot use in workplaces, who are not needed by the economy, and they sit at home and they become another problem.
And when we're talking about job creation, we're also thinking about decent job and also having a kind of sustainable system where people can also evolve and having their career evolving, because this is also what people are expecting. It's not only about producing low-level jobs, but rather to invest in a kind of a top level.
In the health sector, for example, we have so many problems and challenges that we could use technology to resolve those challenges. And here, therefore, we call upon the youth to come in with innovative ideas to resolve these issues and challenges that is within even your community. That's how you create a business. And therefore, it's an application of ICT technology to resolve those common problems that you see every day. So every time you see an issue, you see a challenge, it's for you to resolve it. And because you've gone to school, you are, you can, you know how to use technology. Then you need to start creating a solution to it. That's how you start a business. For us, our role as the Minister of Labour is to really coordinate what is happening in terms of job creation in all the labour market. What I can say with regard to an ICT application that, for example, would resolve an issue in the health sector. I'm sure you've heard of what you call the iHub. The iHub, you actually come and pin your idea on the board. And if it's something that can be picked up by, let's say, angel investors to finance your idea, and so many of them have been financed. The other way you could go about this is to come together as a group. It makes life easier. And once you form an investment group, then one is a marketer, the other one is, a production engineer, the other, So you form a business and you go to the Youth Enterprise Fund and ask for funding. That could be one way. The other way is what I was talking about now. We want to scale up this, skill our youth. Yeah? So you could, once we announce training, industrial training for various sectors, you will need to go to the Ministry of ICT, where they are trying to help and support the youth who are, coming up with technology solutions to ensure that they scale up their what they're doing into a real business. And so these opportunities are there. It's just that our youth don't know. But I think the more you come out there, get into forums, don't stay alone. Get into forums and communicate your idea. But of course, without giving it away, because people take it off and commercialize it.
I think if you want to get contact into the wider stakeholder field, then you need to work with these hubs because they have the connections, they have the networks. But I think one of the other things we want to do as AMREF is to start providing what we call innovators in residence, where we see somebody with a good idea, but instead of working with them out there, we bring them on board. And therefore they have access to our work, they have access to the funding that we have for programs, they have access to our engagement with government, and they have access to the community. And therefore they're able to test within a living environment. So this is one way to get the innovators to move closer to actually realizing their dreams. If you rely just on technology in Africa, you're not going to go very far, because if 60% of the women are rural and only 16% of the people in the rural economy have electricity, then how much can technology do? So there is a thought that technology is a big part of it, but there is room to open up the innovation beyond technology, and also have conversations with the stakeholders like government, ALENA, have conversations with the community themselves, and this way I see Africa going very, very far with technology.
Dr. Harun is among the people who attended the summit. He highlighted some of the challenges in the health sector, and more so as a cardiologist in Kenya.
Well, Winnie, it's been a very interesting conference. There's been a lot of great speakers. There's been a lot of role for innovation, and speakers really explaining what the process is in terms of how to get a company from startup. All this really has been in the space that has been outside healthcare. So this meeting at least has now put this as a focus to try to see whether innovations in technology can actually do something in healthcare. Cardiology in Kenya, a large number of specialists are actually located in the urban centers. So myself, my colleagues, only about 40, 50 of us are all within either Nairobi or Mombasa. So the majority of Kenyans do not have access to our services unless they have to travel long distances to come here. So one of the reasons I actually came for this meeting is to see how can we get a solution that would disperse or sort of spread our expertise out into the rural or even peri-urban areas, so around Nairobi or outside, without me physically actually having to go there. So that's one. Two, all the services for cardiology are actually located in Nairobi, and cardiology has got diagnostic as well as intervention. So heart surgeries, heart tests, those are all mostly done in Nairobi. But now with technology, things are being miniaturized. There's telehealth, there's better connectivity. We need to learn how to exploit this such that now you can actually get your diagnostic heart test in Kisumu. It's read in Nairobi and given a and gives a recommendation to the person in Kisumu. So one of the cheapest ways of doing that is actually WhatsApp. So like right now, somebody has sent me a test, I've looked at it, and I've given them a recommendation. But it's not formal. So how do you formalize it? How do you commercialize it? How do you make it viable as either business, a healthcare business venture, or just for its economic and healthcare impact? How do you do that? So the second issue is about medical tourism. I've been involved with medical tourism both from a regulatory level a little bit, and we've made a recommendation to the government that look, we need to do two things. We need to promote, we need to keep Kenyans in Kenya. And how do we do that? We need to strengthen, train more professionals, keep the cost of care in Kenya also low. So because if it is very expensive, guys will leave, And then what we can also do is bring Africans to Kenya. We've got the best regional airport in the region, 150 million people. All of these guys have to come to Nairobi to fly to India. Surely we need to be able to give them a solution that's actually here. But to do that, we need to be as competitive as India, because people are cost conscious. We also have to have good quality, and we also need to make the investments in the right technology, equipment, such that you're getting the same product, the same drug, the same quality of care as somewhere else. So I think those are probably the 2 or 3 things that need to be done. I think there actually have been steps. The National Health Insurance Fund, I'm a private practitioner, but I do see patients who have national health insurance. And if the cover is good enough, then they can actually access high quality care even among specialists. I'm not going to charge super duper prices. No, we would be reasonable, because we also know that if you can reach more people, you can actually improve the care of more patients by bringing down our costs. The problem has been that if the patients are not able to pay, then how do you provide that service? So healthcare concerns are really the responsibility of all Kenyans, not just doctors. Everybody should be concerned if your mother cannot access good healthcare, if your worker cannot access good healthcare. It has very strong, similar impact to you. The question is, there are several issues that are involved. It's not just the finances, it's not just, equipment, it's better terms also for doctors and also hospitals as well.
And training as well.
And training, yes. So all of these things are important. Whereas I think industrial action and the methods to bring about change need to be looked at, need to be addressed, maybe in a manner that is more where you're both talking. And to me, the biggest thing that we should be fighting for is UHC, universal health coverage. Or no, okay, we don't want to strike. Maybe we want 15% of the budget. What would that do? That would change the healthcare space everywhere.
After a long day of discussions and debates, it was agreed that technological innovations can help progress better standards of healthcare and improve efficiency in delivery.
This is not an African Union summit where we come up with a resolution. I mean, it is really about trying to get people thinking, about stimulating those ideas. As a journalist, it's about informing me. I'm going to be writing in The Economist about some of what I've learned here. That hopefully then also disseminates and informs policymakers. But it's really about people continuing these conversations. So ideally, and I would hope that the Minister of Health from country X is going to continue talking to the young innovator from country Y, and that they're going to carry on sharing ideas. We can't force that. But I think that where the ideas are good enough and where that interaction is high quality, it's going to happen.
My biggest takeaway is we need to use innovation more in healthcare, and particularly in non-communicable diseases. I have listened to and heard the different innovative activities going on around the continent. I'm very impressed that there's actually a lot that is happening. So my takeaway is we need to use innovation more, and as WHO we are going to go into this area to try and expand the use of innovative ideas and products so that we can be able to deliver
healthcare and NCD's healthcare in particular in a lot more efficient way, cheaper, more effective.
First is to recognize that health is a right. It's not a privilege, it's a human right. So the government has a responsibility to provide everyone with healthcare. The government is not able to do that without ensuring that there is universal health coverage. So the government needs to realize the right to provide people with healthcare, then ensure that universal health coverage and health insurance is mandatory. Then after that, bridge the gap between the community and the health system. And you only do that with community health workers.
Personally, I think on innovation, young people are the future of Africa. They are smart, they are curious, they have good ideas, they want to innovate, how to do things we do in a much better way. And I think all they need is support in incubation and support in how to go to the market. Because whatever they produce will have value. We in Centum, we do support innovation. We interview many innovators and we see what is mature, what is able to be developed further, and we put our money in the system and we become partners in innovation with these young people. And we hope in the end they produce something that is bankable.
Kenya is the home for technology and innovation, and we've had such great success with bringing financial inclusivity to all Kenyans through technology. The key question is, how can you do this through health? It's more complex, but I think it's just as important. And I really think Kenya will be the spark for this. This is where it will happen.
All right, so there you have it. Very insightful and informative discussions that we had today right here at the Innovative Economies. And some of the things that came out very, very strong is, aspects of leadership, aspects of creating space, for ideas, that is innovative ideas by young people. And above all, there's also the aspect of funding. So moving forward, we look forward to see different ideas that people will come up with to ensure that we improve the universal healthcare, and at the end of the day, each and every person has access to quality and affordable healthcare. So that's it from the Health Channel. We'll see you some other time.